You know, when you first get exposed to the orthotics and prosthetics world, you can see that it's based on methods and fabrication methods that are just really archaic, you know. Let's take the socket, for example. So sockets, in my opinion, are a lot like a wooden clog or to a shoe, okay? They're extremely rigid, they're a fixed volume, and, you know, what has to fit inside them is the patient's limb. The patient's limb is dynamic, it moves, it's a body part, it's sensitive, it's just like a foot.
It has frustrated me that the technology in my shoes is more advanced in many ways than the prosthetic sockets we can make for pediatrics. So I needed a product or a system that was scalable and also more versatile, that could change with the patient. That's what has really spawned a lot of this innovation. The Infinite Socket has been engineered for scalability. It's a system where we can mass produce different parts and then individually construct those to the customized needs of each individual patient. One of the challenges I've seen with conventional sockets is that the child has a tough time accepting that as part of their persona, as part of their identity, because it's not something that changes with them and it's not something that interacts well with their body. It's difficult for them to accept it as part of themselves. The Infinite Socket would work really well, it would be very applicable to pediatric prosthetic sockets for many reasons. One, it's adaptable, so it can change with them as they grow, and the growth can happen in many ways, and the socket can accommodate that. Their leg can get larger, they can get taller and skinnier. These sort of things are built into the system. They want to be out in the playground, not in the doctor's office. So that's another huge reason why I think that the system would be highly applicable to what kids really want and need.
User adjustability is very important because patients' limbs undergo volume changes both throughout the day and over long-term periods of time, over months and years. So it's really important that the socket is not a fixed shape. It's really important that it's dynamic and that it can be changeable. A pediatric limb grows in size longitudinally over time. It gets longer and bigger. An adult socket or an adult residual limb does quite the opposite. It actually atrophies and gets smaller and smaller.
We want the socket to be much more of a friendly device as opposed to this thing that hurts the child to put on. And that's something that's of course applicable to adults, but it can change the psychological paradigm with pediatric use of a prosthesis.